Atrium Health Behavioral Health Service Line was established in 2013 when we outgrew our current facility and needed to expand. We had services in a lot of locations, so we added more services, but we also added another psychiatric facility, inpatient facility, that's next year. Shortly after, we started a residency program in 2017, and then an APP fellowship as well for our nurse practitioners and PAs to have advanced training in psychiatry. Our service line has been expanding greatly over the last 10 years, and we're now in several states and multiple facilities, either acute care or in psychiatric facilities.
We know for people to be physically healthy, they also need to be healthy from a mental health standpoint. Therefore, training providers at all levels is key to this. We need to, from the very first day of training, weave in a behavioral health curriculum that ensures that they are able to treat patients both from a behavioral health standpoint as well as from a mental health standpoint. We have multiple programs that do this, including a medical school, a residency program, multiple fellowships, and an APP fellowship.
The psychiatric residency program at Atrium Health is a 4-year residency program that takes 5 residents per year, and we offer a very diverse variety of clinical experiences for our residents, to include adult outpatient care, adult inpatient care, child adolescent inpatient, as well as partial hospitalization. And we also offer didactics for our residents. Atrium Health has been at the forefront of promoting diversity, equity, and inclusion. We have been instrumental in establishing the LGBTQ Healthcare Symposium, which is done annually with the Charlotte AHEC. We have established a social justice curriculum in our residency, and through holistic review, we have recruited the most diverse class for our residency program thus far. The Advanced Practice Provider, or APP Fellowship Program, is a 1-year program that gives psychiatric nurse practitioners and physician assistants experiences on clinical rotations as well as didactics.
Technology has been incredibly helpful to allow us to expand access, which is one of our goals for taking care of more patients. We have, in the virtual space, we've been able to provide more care to patients in our primary care practices, in our schools for our children, and outpatient practices, especially during the pandemic. We were able to keep people coming to their appointments.
The EAGLE program is a groundbreaking research program. It's a program for patients that have had a first break to be involved with a research protocol that includes psychiatric care, vocation and education rehabilitation, as well as service coordination. Patients have had outstanding outcomes from this program, including 80% who are still involved in school or work after 1 year of being in the program.
Here at Atrium Health, I work as a physician and medical director in addiction services. Addiction services provides substance use treatment to patients across the spectrum, such as opioids, stimulants, and alcohol use disorders. Our focus on substance use disorders is a whole person, evidence-based treatment program. We work with patients to evaluate what their needs are from a physical, psychosocial, environmental perspective, and work to improve their health and improve their outcomes.
We recognized probably about 5 or 6 years ago that we really had a hole in our system to address the needs of the pregnant, newly delivered women, and so we built a program that would meet their needs on an outpatient basis to provide specialized care for their medications for psychiatry, provide them with individual and group therapy to support them through that time, consult to the obstetricians to help them manage the patients that were appropriate within their office, and also to hospitalize the more critically ill psychiatric patients who were pregnant or newly delivered in a cohorted area so that they'd all be on the same unit and have specialized providers. We think it's very important to address the needs of those patients because it not only impacts their health, but also the health and development of their baby.
Research at Atrium Health is critical. It allows our patients to have access to some of the most innovative and high-quality care, while also allowing access for patients that might not otherwise have the means to get that care. Our Alzheimer's research is one of the top programs in the country. We are part of the Global Alzheimer's multi-platform network, one of only 100 institutions in the entire world to be part of this network. This gives us access to some of the most innovative research opportunities that are available, and also gives us an opportunity, hopefully, to find a cure for this terrible disease.
We hope to continue to expand our reach through our health system in our emergency departments, in primary care and OBGYN and specialty clinics, in hospitalization, and perhaps even with mobile units and residential care services being added.
My hope for patients at Atrium Health is that we are able to continue to expand, provide more access, more innovative care, more education for people, improve the health in the community, and really to hit our mission statement at Atrium Health to improve health and elevate hope and advance healing for all.